Hello, good day. I'm Jermin Ann Marquez and I will be performing the return demonstration of peritoneal dialysis. Okay, so first check the doctor's order. Then after that, grade, introduce, identify, and explain. Hello ma'am, good morning. I'm Jermin Marquez. I will be your nurse for today. May I know your name and your date of birth po? Okay, pacheck na lang po ng wristband ninyo. Okay, ma'am, thank you. So, now ma'am, I'm here to assess you for your peritoneal dialysis treatment, which will be ordered by your doctor. This treatment will help you to remove the waste products from your blood and it can also help your kidney. So, after ko pong maituro sa inyo yung mga procedure, pwede nyo na pong gawin yung treatment na ito to yourself sa bahay ninyo or sa workman at kapag magtra-travel po kayo. So, I need your cooperation po during this procedure. Is that okay with you, ma'am? Okay. So, the first thing that I'm going to do is the preparation. So, I'm going to turn on the light here in the room and then close the door or the windows to provide privacy. And I will also make sure na naka-off yung electric fan or the air conditioner. And then after that, I will now prepare the equipment that I'm going to use. Okay, so such as hand disinfectant or yung alcohol pang hand washing, then the record book, the drip stand and the weighing scale, surgical mask, alcohol wipes, 2 mini cups, the dialysis solution with drain bag attached, and the basin. Okay, so ma'am, before we proceed, I will first measure your blood pressure and your pulse rate po. Okay, so palagay po itong pulse oximeter sa daliri ninyo to check your pulse rate and your oxygen saturation na din po. I will also check your blood pressure po. Relax lang po kayo dyan. Okay. So, after that, document the result in the record book. Then next, I will now wear surgical mask. So, ayan, kunyari may nakasuot na ako ng mask. Then, si patient. Then, perform hand hygiene to prevent the spread of microorganisms. Then dry hands using a clean paper towel. Next is to wipe the table with an alcohol wipes. Okay. Then clean the drip stand using the alcohol wipes. Pati na din yung weighing scale. And hang natin. So, sa ating dialysis solution, we need to check the concentration, expiry date, volume, then check for leaks sa pouch. Okay, kung may tubig. And check also for the green pole ring, frangible seal, and the 2 clamps. Ayan. Then do again the hand washing. Dry hands with a clean paper towel to prevent again the spread of microorganisms. And after that, I will now get the dialysis solution. Okay, remove it to the outer pouch. Okay. Then hang the dialysis solution in the drape stand. Then separate the attached drain bag from the dialysis solution. Okay, and also separate the lines and hang the patient connector end on the drip stand. Okay. Then the next thing that I'm going to do is to pull both of the blue and white clamps down, then close them. So after ma-close, I will also make sure na naka-intact yung green pole and the green pole ring and the frangible seal. Okay. So we also need to check that the dialysis solution is clear and squeeze both sides to check for any leaks or leakage. Okay, so ayan. Next is for the connection. So sa connection, I will now take out the transfer set from the waist pouch of the patient. Okay. Then after that, perform again hand washing to prevent the spread of microorganisms and dry hands completely with a paper towel. So let's remove the green pole ring by pulling it outwards and drop it to the ground. Okay, then the other one, yung transfer set, remove the mini cap. Ayan. Then remove the mini cap carefully, then drop it again to the ground. Okay, then connect the patient connector to the transfer set and make sure na nakasecure ito. Then after that, place the drain bag into the basin. Okay. So for the draining, open the twist clamp on the transfer set. Okay. Then open the white clamp on the drain line. So draining takes 20 minutes to complete. So while draining is taking place, record the time and percentage of the dialysis solution sa ating record book. Okay, so after 20 minutes, draining is completed. Close the twist clamp of the transfer set. Then close the white clamp. Then after that, weigh the amount of drainage. Then check the clarity of the drainage. Ayan. Then next is to document the amount of drainage, time taken to drain, clarity of drainage, and balance calculation in the record book. Okay, so for the flushing and filling procedure, break the green frangible seal on the dialysis solution. Okay, so i-break natin to. Then open the white and blue clamps and do a count from 1 to 5. 1, 2, 3, 4, 5. Then close it after the counting ends. So after that, open the twist clamp of the transfer set. Then open the blue clamp on the fill line. So filling of the new dialysis solution takes about 8 to 10 minutes to complete. So once the filling is completed, close the twist clamp on the transfer set. Then close the blue clamp on the fill line. Okay. Then record the volume in and time taken to fill in the record book. Okay, next is the disconnection. For the disconnection, place 2 mini cups on the table. Then check the expiry date of the both mini cups. Okay. Okay, ma'am, if you are performing the therapy yourself, perform a double 7 steps of hand rub using the hand disinfectant. 2 beses po. But for now, I'm your nurse. I'm the nurse or the caregiver. I will perform the 7-step hand washing, and then I will dry my hands completely using a clean paper towel. Okay, so next, open the mini cup package. Then check for the presence of iodine sponge. Okay, so the other mini cup will only be used if the first mini cup is contaminated in any way. So, ayan. Remove the patient connector from the transfer set. Then, close the transfer set with the new mini cup securely. Then, I will now put the transfer set back into the patient's waste pouch. Okay, then next is to empty the contents in the drain bag and flush it down to the toilet. Okay. So, ma'am, tapos na po yung procedure. Naintindihan niyo po ba? Do you have any questions or any clarifications regarding to the procedure that have been performed? Okay, kung wala na po, I will now go to the nursing station, and if you have any concern or if you need help, just press the call bell anytime. Thank you po for your cooperation. Okay, for the end of the procedure, do the aftercare, perform hand washing, then document the procedure.